And just to open this second part, I would ask my very good colleague, Dr. Andreja Rafaelič, to welcome us. And I will present her shortly, since not all of you have been in the morning with us. So Andreja Rafaelič is a social worker. She's an assistant professor at the Faculty of Social Work in Ljubljana and a researcher at the Social Protection Institute of the Republic of Slovenia. She's an expert in the field of deinstitutionalization with international practical consulting and research experience in the development of community care and the transformation of institutions. She is also a director of the International Educational Program, Social Work and Deinstitutionalization at the School for Social Work Theory and Practice at Inter-University Center in Dubrovnik. Andreja, the floor is yours.
Yeah. Okay. Thank you. Yeah, I'm very glad to have the honor to speak for the first and the second part of this meeting, because for us it's a very important meeting, because it's like now it's the the moment where Slovenia is starting preparing the institutionalization strategy. So in a way, I feel like I have the honor to open up one of the first sessions, and when we publicly discuss how the strategy will be prepared, and to invite everyone in this process of drafting the strategy, and then later on in the implementation, of course, of the strategy. One thing that we pointed after the experience we had in Črna, of course, with the first attempt of creating intermediary structures that are somewhere halfway from community and institutional care, was that it's very important to also acknowledge the situation of children with disabilities in this institution. So at first, when we started thinking of drafting the strategy, the point were the adults, but then of course we realized if we don't do something for children as well, if we don't show them the respect they deserve, then we will be just breeding people to be able to live in institutions in their adult life. So today I hope we will, with the chances to build upon these good examples of Bulgaria, of Lumos in the Czech Republic as well, and on the Greek good experiences. I hope that we will be able to, after this meeting, to be having at least a feeling on how services for children should look like, and how to preserve or prevent the children from these horrible experiences and damaging experience that it is for a child to live in an institution, even for a very short period of time. So this opportunity is also an opportunity for Slovenia to start thoroughly and very decisively this process of closing down institutions for children. Building on what we will hear today, I hope that we will be able to get this image of what that means and what it means to be really decisive in this, not to just think about how to improve the institutions, how to improve the quality of life, because we all know, and we've heard this morning from George, that that's impossible. Then whatever, no matter how much we improve them, there will always be a place of exclusion and a place where it's more risky to be than in the community. And it's also, of course, I would like to hear today from George and Petra and Bisser on what sort of support should be developed from children in the community. Because we know that small group homes, even if they're for 6 children, because everything after that number is already an institution, we know that that's not the best possible solution. We know that children should be living at home with their families, biological or foster or adoptive families, but or in very, very small family-like places. Also, another thing that this is one part of taking care of the children, but also the other part is also how to include children in the community, in ordinary schools, to get them the right to be able to receive mainstream health care, mainstream social support, and so on and on. And also, what the most important thing probably, how to make it possible for children to play and grow up with their peers without disabilities or without which are not in the vulnerable position. So yeah, I hope that at the end of this discussion today, we will have a better knowledge on which way to go forward when drafting the strategy. And the other outcome I expect is that everyone who's here that will be more interested in participating in the drafting the strategy and will want to be involved in advocating for the institutionalization in Slovenia.
Thank you, Andreja. I would just like to emphasize that till now it seemed like there's some kind of a silence about children that are in institutions in Slovenia, and on how necessary this process of the institutionalization is. And that's why also this event is so important. And we hope and we will work in the way that this is not the only event. So we will plan future events on this topic also. And now I would like to welcome our next guest, our next speaker, Dalja Pečovnik. Just a short introduction. So Dalja Pečovnik is at the moment the director of the Training, Work and Protection Center Črna na Koroškem, where she's also leading the project of the institutionalization, so of the transformation of this institution. And she has many years of experience in the field of care for adults and children with intellectual disabilities and in long-term care. Dalja, welcome. And Andraž Kapus will translate, since Dalja will be speaking in Slovene.
Hvala lepa, pozdrav vsem skupaj. Hvala za predstavitev. Sem Dalja Pečovnik. Kot je že Katarina povedala, sem direktorica Centra za usposabljanje, delo in varstvo v Črni na Koroškem.
Thank you everybody for presentations and welcome. I'm Dalja Pečovnik and I'm the director of the Center for Education and Care in Črna na Koroškem.
V Centru za usposabljanje, delo in varstvo v Črni sem zaposlena od leta 1989, zato spremljam že kar 3 desetletja ta dogajanja dela z otroci s posebnimi potrebami.
I'm active in this field since 1989, so I'm working with children with special needs, so I have experience in seeing the process of which happens in Slovenia.
Otroci s posebnimi potrebami so zaradi svoje ranljivosti in potrebe po posebni negi in skrbi upravičeni do posebnega statusa in pravnega varstva. In za celostno uresničitev njihovih pravic je potreben družbeni dogovor in tudi močna politična volja vseh deležnikov, ter s tem povezano zagotavljanje finančnih sredstev za odpravo različnih ovir, diskriminacije, institucionalizacije in vzpostavitve sistema dolgotrajne oskrbe ter življenja v skupnosti.
Since children with special needs require certain care and have also status which enables this to happen, we also have to have like a broader consensus about what should we do and what their rights are, and also some guarantees from the financial side and the system itself, how this should develop.
Z sprejemom konvencije o pravicah invalidov se je pravni položaj otrok s posebnimi potrebami v zadnjih letih precej izboljšal, vendar pa še ostajajo ovire in izzivi, ki jih je potrebno reševati sproti.
With the Convention of People with Disabilities, which was accepted in Slovenia, certain things have changed for the better, but there are still certain barriers we have to address and change.
Center za usposabljanje, delo in varstvo, v katerem delujemo, se v tem obdobju nekako loteva procesa preobrazbe in deinstitucionalizacije.
So center in which we work in, so Center for Education and Care is now starting the process of dezinstitucionalization.
V tem obdobju se dogajajo precejšnje spremembe tako na področju dela z odraslimi, kakor tudi na področju dela z otroki, s katerimi se center intenzivno pričel ukvarjati v letu 1968 ob svoji ustanovitvi.
So during this process, a lot of changes are happening in the field of working with adults and children also. And this is like the continuation from the 86 when the center was established.
In skozi ta zgodovinski razvoj bi želela poudariti, da je CUDV Črna šel skozi številne prelomnice in sicer je od leta 68 začel delovati kot Zavod za delovno usposabljanje mladine za otroke in mladostnike do 18. oziroma kasneje do 26. leta.
So from the beginning, the center from 68 started as a educational center for young adults to have possibility to work, and during all the history the centers is facing a certain breaking points, which will now Dalja tell us about.
In v tem obdobju od začetnih prvih sprejemov 15 otrok, kasneje do 10-kratne povečanosti okrog 150 otrok in mladostnikov, ki se je izobraževalo v tem centru za usposabljanje, delo in varstvo, ki se je kasneje preimenoval CUDV Črna, lahko rečem, da je šlo res veliko otrok skozi posebni program vzgoje in izobraževanja.
So from the beginning, 15 children were involved, and then it expanded to 150 children. So a lot of children and adults went through our program of education and care.
To je bilo obdobje, ko se je začelo nekako prepoznavati, da je potrebno pripraviti ustrezne programe in strokovne podlage za izobraževanje otrok in mladostnikov z motnjami v duševnem razvoju.
Yeah, so we started to think about how to develop certain specialized programs of education for children with disabilities.
Otroci in mladostniki, ki so se izobraževali v teh posebnih programih vzgoje in izobraževanja, so šli skozi številne pomembne strokovne usmeritve, skozi zelo pomemben in kakovosten razvoj izobraževanja, ki je bil prilagojen osebam z motnjami v duševnem razvoju, osebam z intelektualnim primanjkljajem, in nekako se je ta program nastavil v 3 razvojne stopnje.
So children and young adults who went through the program were supported by a lot of different professionals and their knowledge, and the development of these education programs went to different stages and developed into 3 phases. So, and this program was meant for children with intellectual disabilities.
Tako so otroci šli skozi faze zgodnjih obravnav v instituciji in kasneje tudi se nekako usposobili in opolnomočili za življenje in delo, tako v programu vodenja, varstva in zaposlitve, kakor tudi za življenje v skupnosti.
So the children and young adults who went to the program went from the first starting point through the process when they were educated and for the work and also for the living in the community.
Vendar je kasneje z inkluzijo in z integracijo, z vsemi temi sodobnimi usmeritvami nekako začelo prihajati do vključevanja otrok v druge programe izven CUDV-jev.
With the development of the other inclusive programs, our users also started to get involved in the outside programs.
Vsekakor je bila to pomembna in zelo pozitivna prelomnica za otroke z intelektualnimi ovirami, ki so se pričeli vključevati v različne šolske programe, v večinske šole in nekako postali bolj družbeno vključeni in enakopravni člani naše družbe.
So this was an important breaking point for our users, since they could go out of our institution and get involved in other programs, also in regular schools and different programs that were available.
In to obdobje 90-ih let je nekako bilo precejšnja prelomnica, saj je pričelo število otrok v teh CUDV-jih upadati. Otroci so se vključevali v druge programe, pričelo se je večati število odraslih, vendar pa opažamo, da se je takrat pričelo tudi nekako večati število mladostnikov z motnjami v vedenju in čustvovanju, ki so se kasneje začeli nekako vključevati v CUDV-je, bolj nekako s temi karakteristikami.
So this was a positive development, and in the 90s the process started that less and less children were coming into our centers and similar centers in Slovenia, and a number of adults started to go up. So we took in more adults and also a lot of youth with behavior problems.
Ker so takrat CUDV-ji, nekako CUDV Črna je takrat bil večinoma po 90-ih letih začel postajati bolj zavod za institucionalno varstvo odraslih in je nekako postajala tu večinska populacija, so tudi otroci ostajali in živeli v teh enakih prostorih tudi z odraslimi.
So in the 90s, less and less children were living in our center and more adults, but at the beginning the children and adults were living together.
Leta 2010 je CUDV Črna prijel tudi sklep ministrstva, da postane CUDV, ki sprejema otroke in mladostnike s sklepom sodišča.
So in 2010, we also, with the development of the legislation, we were ordered by the court to include some of the youth people, I mean, young persons.
Tako smo v tem obdobju pričeli nekako zaznavati spremembo, predvsem na tem nivoju otrok, ki so se vključevali k nam že starejši v obdobju adolescence in pa tudi z različnimi pridruženimi težavami v vedenju in čustvovanju. In tako smo pričeli nekako delati tudi z temi otroki, na katere pa se posebej ni bilo posebnih programov pripravljenih za te otroke in mladostnike.
So we received more and more young adolescents with behavioral problems, and but we also had problems because there were no programs developed for these children or young people.
Tako smo se v tem obdobju srečevali s številnimi izzivi na področju dela z otroci in mladostniki z motnjami vedenja in čustvovanja. Nekateri izzivi, ki jih lahko naštejem in ovire, so bili predvsem neustrezna prostorska ureditev, bivanje v večposteljnih sobah, bivanje med odraslimi, bivanje med šibkejšimi.
So we faced a lot of challenges supporting these children, which had like behavioral emotional problems because there were lack of space. There a lot of people were living in the same room, and also different people with different strengths live together.
Lahko pa s ponosom poudarim, da na podlagi vseh izkušenj dela z osebami z motnjami v duševnem razvoju, ki smo jih pridobili v preteklosti, je strokovni kader in tudi ves preostali kader zelo kakovostno in intenzivno delal s temi otroci in mladostniki in nastali so zelo kakovostni in inovativni programi.
So our staff have to work with a lot of different challenges, and with this we got a lot of experiences, and we developed a lot of programs or ways to tackle the situation.
Vendar bi želela tukaj poudariti, glede na smernice, ki jim sledimo v tem sodobnem, zdajšnjem obdobju, da prepoznavamo takšen pristop kot pristop, ki ga bi bilo potrebno umestiti na drugačen način v našo sistemsko ureditev dela z osebami z intelektualnimi ovirami.
So, but we recognize that this knowledge should be placed in different settings with the new development of the policy and guidelines.
Predvsem se mi zdi pomembno poudariti dejstvo, da je v tem obdobju, ko sedaj prihajajo otroci in mladostniki v institucije z določenimi vedenjskimi in čustvenimi težavami, predvsem potrebno poudariti to, da so to nekako motnje in težave, ki jih otroci pridobijo iz vidika svojega zgodnjih obravnav in pa iz nekako nemoči družine. In zato bi želela poudariti, da je morda tukaj potrebno razmišljati predvsem v smislu bolj intenzivnih programov v zgodnjih obravnavah otroka v domačem okolju, skupaj z njegovo družino, opolnomočiti družino in jih na tak način nekako ohraniti in ubraniti pred temi težavami v vedenju in čustvovanju, ki se kasneje pokažejo, in mnogokrat je te težave skoraj nemogoče odpraviti.
I would like to emphasize that a lot of young adults who come to Črna have pre-existing emotional and behavioral problems which stem from their first approaches to care and support, and the inability for families to support them. So I find it's important that we give a lot of attention in the future to the home care and supporting the families and children before they come to us, because when they come to us, it's really hard to help them.
V teh situacijah bi morda ob pravočasnih obravnavah lahko tudi preprečili kasnejšo namestitev v institucije in bi lahko v primeru ustrezne podpore v domačem okolju tak otrok ostajal v domačem okolju tudi naprej. Predvsem z ustreznimi programi, z ustreznimi usposobljenimi timi, ki bi delali v teh programih in v okviru opolnomočenja celotne družbe, ki bi bila naravnana na delo na teh programih.
So I found that I think that if the children would be supported soon enough and in the places that they live, a lot of these problems would disappear, and it's important that we establish programs in the community with the families.
V primerih, ko pa otrok vstopi in mladostnik vstopi zaradi teh težav v čustvovanju in vedenju v institucijo, pa je potrebno razmišljati predvsem v tem smislu, da smo morda tukaj en korak spredaj in da razmišljamo, da jih namestimo v neke vmesne strukture, kjer jim bomo zagotavljali predvsem spodbudno okolje, skupaj z delovnimi aktivnostmi, ustrezen usposobljen kader, multidisciplinarne timske pristope pri delu, z ustreznimi programi za delo, da jih socialno vključujemo v okolje, da jim damo možnost samostojnosti in odločanja o njihovem življenju tudi v prihodnje in da jim na tak način lahko zagotavljamo tudi čim več stika z njegovo primarno družino. Tu se mi zdi zelo pomembno poudariti še to, da na tak način lahko otroka v primeru zagotavljanja teh resursov opolnomočimo v tem smislu, da nekako postane tudi ustrezno tudi naprej njegovo vedenje in da ga lahko kasneje tudi umestimo v skupnost in da lahko zaživi tudi v skupnosti v obdobju odraslosti kot enakopravni član družbe, s tem, da mu nudimo ustrezno obliko podpore v skupnosti.
So, but when the situation arises, when the person has to come to the institutions, I think that we should stay one step ahead and include them in intermediate structures with the support of the staff, multidisciplinary approaches, specific programs and social inclusion to develop their independence and to also keep the contact with their primary families. I feel that with enough resources we could support the child to tackle the behavior of the child, so we can place them back into the community and so they could live in the community again.
V CUDV Črna želimo z procesom deinstitucionalizacije in pa z preobrazbo CUDV Črna kot institucije v center skupnostnih oblik oskrbe tudi našim otrokom zagotavljati ustrezne programe, ustrezno namestitev, usposobljene time, ki bodo lahko te otroke opolnomočili za življenje v skupnosti tudi v kasnejšem življenjskem obdobju.
So with the dezinstitutionalization process of our centers, we would like to develop programs and place the people in an appropriate environment and also educate the staff and create teams who would support them living in the community.
Hvala lepa za vašo pozornost.
Thank you for your attention.
Okay, thank you, Dalja, for this presentation, and thank you, Andrej, for translation. Now we will move forward. I just want to say that I really like, Dalja, how that you emphasized how urgent it is to develop a family-like caring community for children and young people with more complex needs, because as we heard in the morning, these children are usually staying or ending up in institutions. And now to our second guest, so Dr. George Nikolaidis. George was already a speaker in the morning. He had a great presentation and made a good case on why institutions are harmful. And for those of you who weren't with us, just a short presentation about George. George Nikolaidis is a psychiatrist and a director of Center for the Study and Prevention of Child Abuse and Neglect in Greece. His scientific interests include many different areas, such as public health science, epidemiology, health policy, quality assessment of health services, philosophy of health sciences, psychoanalytic theory, studies on the phenomena of violence and death, and research methodology. He conducts trainings on child abuse and neglect, domestic violence, social inequalities, mental health reforms, and so on. He has been teaching in postgraduate master's degree programs at the Hellenic National School of Public Health at the University of Athens. George, there's much more probably we could say about you, but the floor is now yours.
Thank you again for the reintroduction. I will just continue in a sense with my morning presentation. In my morning presentation, I try to elaborate why we consider that institutionalization is harmful for children, both with and without disability, that international organizations have increased visibility on this particular phenomenon, urging states to intensify their efforts to eliminate institutionalization in favor of other family-based community services for children in need. And I've tried also introduce our experience, which was in particular to a horrible institution in Lechena in Western Greece, which was an institution for children with disabilities, and in which there were very harsh restraining practices when we first went there in 2015. And right after that, let me just make sure that works. Okay. We've established a collaboration with a UK charity fund called Lumos. Bisser and Petra were also presenting earlier this morning. And we've launched an initiative to intervene in the particular institution in Lechena, beginning from all the bureaucratic negotiations with the government, with the administration. Initially, there were two phases provided. The first one was data collection and needs assessments of individuals placed there, and then the implementation of a DI reform plan. However, it was assessed to be necessary to introduce an intermediate phase, which is emergency intervention as a bridge phase between data collection and planning and DI implementation. And that was in virtue of the fact that the government and the administration of the institutions were quite reluctant in proceeding with more quicker steps towards the institutionalization. Therefore, we could not stand still seeing persons being tied up all the time or being placed in cages and so forth. So our intervention program was threefolded eventually. We've begun to work with residents one by one for removing the restraining, the restraints, taking them out of the cages. That was not an easy task, given the fact that some of them have been placed there for 10, 15, or even more than 20 years. And that create the necessity for a behavioral program for them to readjust, to move around freely without all this kind of restraints. The same equally applied to the pharmaceutical restraints, because as I already mentioned in the morning session, there were all of them that were heavily medicated with severe sedative medication, and that took the form of particular reports in following up our implementation. And there you can see a series of images depicting the process of change. You see the first picture was what we had found, a girl at her 16 by the time was permanently tied up in a cage with her hands behind in the bars of the cage, and then we've untie her, and then gradually we've introduced her to communicating with other residents and try to obtain as much autonomy as it could possibly happen within the institution's context. Again, people relieved from permanently being tied up with belts in their beds, and organized activities, taking some of them to the beach, having a swim for the first time in their lives. For me, the most impressive thing was that those of us who have worked in this intervention program, we have been witnesses of people reclaiming their subjectivity. That is to say that it's quite touching to see people that have been treated as objects for many, many years, and therefore had no room of expressing any kind of preference or subjective practice or will or preference or whatever, to witness the moments in which one of the residents have chosen just one to seek for physical touch. So it was a very touching moment of witnessing people reclaiming the subjective status as opposed to the status of objects with which they have been treated for many, many years. Now, simultaneously, we have drafted an action plan which was comprehensive on how this horrible place could be set down and be replaced by a different series of services, both for the current residents, but also for meeting the needs of the local community that have been served by the institutional model. And this is of paramount importance in any attempt to try to implement any DI reform initiative, that we should take into account not the needs of current residents in institutions, but the dynamics of new admissions, new demands for institutionalization. Families or services that refer families to institutions for their children to be admitted are not necessarily having some malevolent motive. They are misled, they are misinformed, they are guided there by necessities in virtue of the fact that there's no community service to help them. For instance, a typical example in my country is a family with, for instance, 3 children from which one has disability that has kept her child until the age of 10, 11, 12, and by the time adolescence comes in and sexuality emerges, the body is much stronger. It's very, very difficult for the family to be able to cope with caring for all their children at the same time. So families are being totally crushed in the dilemma of either caring all the time for the child with disability and neglect the other without, or give away their child with disability to institutions because there are no community services to help them in caring for all their children. So the plan provided for the development of services, not just for the transition, but also for caring those children that live there, but also other children and families with children that have similar needs, and also provided for a pylon of preventive activities in order to prevent institutionalization of new cases. And therefore, it was designed not just by taking those residents out in small structures or foster placements or in their families, but also it included a very detailed planning of after-school clubs for children with disabilities, therapeutic units, parent support groups, other type of mobile units in order to serve all the geographical area that was supposedly covered by the particular institutions, respite centers, which are totally missing in the Greek child protection system, day centers for adults with disabilities, young adults, which of course have special needs to be met. And that plan was submitted to the EU, the European Commission, the respective authorities, also to the government. We advocated a lot, and by the end of 2017, there was a joint ministerial decision by the Greek government that provided for 50 million euros, which is quite a lot of money for the context of the Greek welfare system, to be dedicated exactly for deinstitutionalizing the particular institution. For the first time, probably the usual excuses that we hear that there's not enough resources could not suffice, because there were enough resources eventually. By that time, by the end of 2018, all residents have been gradually removed from restraints and cages, and the belts were not there in the institutions. However, there were limitations in the progress which could be made within the institutional context. So we've tried to develop their capacities and skills, but while they still live in an institution, that met a wall. There was a certain barrier which could not be passed due to the fact that they were still living in the institution. And therefore, by the end of 2017, we got the money as well, and we got the plan, and supposedly we got the political will. I was smiling when I heard in the morning session about Stella Grigoras mentioning the Greek government's will to proceed in the institutionalization. I would be more reserved, and have told her anyway, because our politicians are very keen in subscribing to things without really meaning this subscription to certain concepts. 5 years after, the plan is not implemented yet at all. No one has been moved from the plan. By the end of by March 2019, our collaboration as Institute of Child Health with Lumos was concluded. A few months after that, we were driven out of the institutions. We are proud that when we left the place, it was a totally different place than what we had found 3-4 years before, with no one in cages, no one in restraints, no one with heavy sedative treatment, but they were still in the institution. We have achieved to make the transition for a very old-fashioned, harsh institutional residential care, in quotation, without any kind of incident in the transition for the residents. We have managed to lobby for securing 15 million to draft a detailed plan on how to do it. But right after that, we were kicked out of the institution. And the money is still in the bank without being utilized. Why was that? Because of low-level resistance, which was there from the very beginning of our first day that we set our foot in the institution. Both employees, the administration to some part, the local authorities, because the local villages live by this institution. And I don't mean just that some people are employed in that institution. I also mean that people are selling grocery, gas, diapers, other commodities to the institution, so they live by that, so they are afraid. And they lobbied and advocated and persuaded the previous minister, probably the current minister as well, to employ the same political communication tactics. Make very good statements on how there is political will and determination to proceed with the institutionalization, and especially with that particular institution, but do absolutely nothing on the ground to proceed in the next stage. So what I'm wondering all these years after following 2019 was the question, have we defeated the dragons, but eventually have been eaten by the worms, because this thick network of low-level resistance is always apparent in many institutions, not just in that particular one. However, I consider that it was good that this whole initiative showcased that this is possible, it's doable, even the worst institutions to be transformed in a relatively short period of time into something totally different. Now, there are challenges for the governments, for child protection stakeholders locally and nationally, not to continue to advocate for institutional care, but instead of that, endure the frustrations and continue to advocate and push forward the agenda of the institutionalizations, but also international stakeholders, European institutions, to take a more active stance, to take more decisive steps in proceeding with desinstitutionalization. I would add also in spotting and highlighting the dangers of reinstitutionalization in small group homes or shelters or rehabilitation centers that sometimes emerge, because we have seen in countries, in my country, in mental health sector reform, but in other countries also in child protection and in disability sector, we have seen countries utilizing enormous, usually EU funds, supposedly for developing, deinstitutionalizing community-based small group homes or shelters or structures, which eventually are worse asylums than the previous big size institutions. So we need from all of them not just wishes or mild recommendations, we need decisive steps in order to push forward visible milestones of making this happen, making this vision happen, that no child in Europe should be placed in institution in a visible point in time in the directly foreseeable future. You can see, of course, many more if you want from our work, and in particular from the Lechena intervention, but also our interventions in other institutions currently by implementing the pilot phase of the Child Guarantee Program of UNICEF and the European Commission in Greece. We are implementing a series of actions in 5 institutions in Attica region, one of which is for children with disability, the other 4 for children without disability, hoping that we will be able to also deliver 5, by the end of 2022, 5 concrete plans, action plans for closing these institutions within the next 3 years. Also we are working closely with community-based social services of municipalities for introducing early intervention programs for families with needs that might turn into danger for the children, for standardizing the procedures of estimating the danger of children when social services go to make a social inquiry under the public prosecutor's order, and also for introducing something which has not been introduced yet in a systematic manner in the Greek context, which is emergency intervention for children that have been removed from the families in order for situation to improve in their families, and those children to be able to return to their families as soon as possible with safety. So we are trying to proceed with that initiative of DI, and I wish you the best of luck in Slovenia, and whatever I could do or my colleagues in the Institute could do to support your efforts, please do not hesitate to ask. If we can, we will be more than glad to assist your good efforts. Thank you.
Thank you so much, George. I think it was very interesting that you pointed out the European money, because it's a similar amount of money that Slovenia now got for 2 projects of the institutionalization for 2 institutions. And I think sometimes it can be even an obstacle when there is no real strategy and the political will to change, or like you said, there's no really decisive steps in this way to change the system.
It was exactly the same in Greece around the millennium years with the mental health sector reform. There were enormous amounts of EU money flooding the market in Greece, which resulted in such a poor outcome and in such extremely harsh practices of isolation of those poor people who have spent their lives in mental health institutions that really undermined the very core of the concept of the institutionalization in this country. In that perspective, it might have done worse than good.
Yes, and I think that's why we need this national strategy and commitment to change the system and not base it just on the project. So thank you very much again. And now I would like to invite our next speaker. And for all of you who weren't with us before, a short introduction. So Ms. Petra Kačírková is the director of the Czech branch of Lumos, and she has been its leader since its establishment in 2008. She's a member of the International Advocacy and Training Team, Lumos, and a member of the Government Committee for the Rights of the Child in Czech Republic. Welcome, Petra, and the floor is yours.
Hello, dear colleagues, it's an honor to be with you here. I want to apologize my voice because I was confirmed yesterday Omicron positive, but I hope it still sound like you can stand it for 15 minutes. I will ask Bisser to share the screen because he just proposed me to support me with the technical side of the presentation, which I'm very grateful for. And I just would mention, before we will go to the presentation, I just would like to mention that I also, what I had been hearing this from the morning, it just confirmed all my experience from my own country, but also from the other countries, and that we are fighting still the same challenges, and somewhere more successfully, somewhere less successfully. And also this issue of big resistance in some countries, this was my daily life for, let's say, 10 years. It's much more better right now. It took long, quite, and I think that in countries where there is the resistance, change is of course possible, but may take maybe sometimes a bit longer, but always change will happen. So I just want to empower your fight to not to stop and be persistent and not expect outcomes in 1 or 2 years, but sometimes it may come longer, but sometimes it really can be achieved quite fastly. Thank you, Bisser, for the presentation. So next slide, please. Yeah, we would like to just, I would like to just very shortly cover what services are needed to replace the institutional settings, because many of such things already had been mentioned from the morning. So what's very important is really to be aware that there is need for the services to actually ensure that no more children will be entering the system, or less children will be entering the system. That's a very important step. I just would like to say, as an example, in my country, actually, Milan Šveřepa mentioned that there is the very fresh ban of putting children under the tree to institutions, and everyone was discussing, okay, so the alternative is short-term foster care, and none of our politicians actually had been talking about the prevention, which is the crucial point to the changing the system. So what is really needed are the universal services which are inclusive, so healthcare services and education services services, but which are accessible for all children, also for children with disabilities and their families. And then, of course, there is need to have targeted services for children in risk and also for families with children with disabilities. And I will not go to the details because I'm very positive that you know all these. So please, next slide. I just would like to dwell for very short time on the family support services. As I stress, it's very important to build the network across whole country of the family support services. And I think that Mrs. Dalja Pečovnik mentioned that if you provide soon enough support, then many children actually doesn't need to leave their own families, because family, I mean, especially children with disabilities, their own family is able to cope. And also when they are approaching teenage years, which is quite challenging time for families. So these services really need to empower families to address short and long-term challenges and reduce problems and risk, and also to ensure, which is very crucial, that the children can remain with their families, which means in the same time that system should provide the family with respite, that system should help the family to recover and to get the energy and to be able to care again for the children. So the respite services are the very important part of the care system for children with disabilities. Next slide, Bisser, please. I also would like to mention foster care, which is also, this is the actually alternative to institutional placement and to small group home placement, which we discussed, and it was described by Stella, that it actually small group home should be short-term solution, whilst in many countries in our region who are coming through the transformation, it's quite often seen as a long-term solution, as an alternative to institution. And I think that this topic needs to be discussed, and the challenges connected with creating the small group homes should be really listed, and there needs to be plan how to avoid all the risks which are connected with the creating small group homes. I also would like to mention that in many countries in our region, people are saying foster care is excellent, but usually the children with disabilities, they are left behind. No one wants to care for child with disability as a foster parent. It's so exhausting. So actually foster carers needs to have the access to the same services, support services, as the families, as the biological families with the children with disabilities. Otherwise it will happen the same as with the biological family without the support. They will be exhausted, they will not be able to care, and the child will need to be taken into care of the state. Also, what's very important in the recruiting, in the actually searching for such a persons who would like to provide the foster care for children with disabilities, it's very important to tailor the recruitment campaigns to do everything you can. And there are some tools already which are quite helpful. So we are very happy to share it later on, what is helpful in the recruitment campaign for foster carers fostering children with disabilities. Next slide, please.
Here, sorry, I want to show very short movie. Yeah. Because when we started in Bulgaria with one of the most challenging homes, nobody believed that foster families is possible option for children with severe disabilities. And to be honest, many foster families don't want to take children with disabilities. In Bulgaria, we have a special system when they apply for foster families, they announce for what kind of children they would like to take care. And when we are talking for children with disabilities, we are talking for children with not severe disabilities, with light disabilities. But it was really not in purpose, but when we were working in this home, it was a case of one boy with very severe disabilities, and now 5 years already he is living in foster care. And we made this short movie to show to people in Bulgaria, not only to people in Bulgaria, that sometimes things that seem impossible, actually they are possible.
When Isus celebrated his 15th birthday, he had his first real party. His friends were invited. There was music, food, entertainment, and attention. All the things that every child should grow up experiencing. But life wasn't always like this for Isus. For 10 years, he was confined to a small bed in a cramped room in what was referred to as a children's institute in Bulgaria. He was fed there, changed there. His whole world was his bed and the ceiling above it, not even a window to look out of. Never having felt the warmth of the sun on his face or the wind in his hair. For decades in Bulgaria, children with disabilities were torn from their families and consigned to overcrowded and understaffed institutions. With little attention paid and few resources, many of them died of neglect. When Isus caught an infection, doctors said they'd done all they could. The institution waited for him to die too. But then, someone extraordinary entered his life. After a 20-year career in advertising, Dima had quit her job and enrolled in a course to work with at-risk children. She was eventually assigned to an institution where she met Isus. When she first visited, the institution was suffocating. 38 children occupied 5 small rooms. The stench was unbearable. But Isus captured her attention immediately. His big, beautiful eyes spoke of a tender soul, she says. From that moment, both of their lives changed forever. With Loomis's support, Dima continued to visit, taking him outside with a stroller into a play area that Lumos helped to establish. The first time he felt the wind on his face, he started laughing. She hugged him and saw a tear in his eye. The Krushari institution where Isus lived was one of the largest and most notorious institutions in Bulgaria. The government appealed to Lumos for help. Lumos sent a team of experts in to stabilize the children's health, and work began to move them to alternative care. Dima has been Isus's foster mother for 5 years now. His doctor is astonished at the huge improvement she's seen in him. He's a fighter, she says. He must have known a mother like Dima was waiting. If only she had found him sooner, she speculates. His development would be further advanced. Isus and Dima's story is just one that's unfolding right now in Bulgaria. It's a new beginning for them. With Loomis's support, Dima's choice to become a foster parent wasn't one of practicalities or economics. It was a choice between life and death.
Okay, I'll just ask for a short translation from our colleague Andreja Kapus.
Ok, ko je Isus praznoval 15. rojstni dan, je imel prvo pravo zabavo. Povabljeni so bili vsi njegovi prijatelji in zabava je bila glasba, hrana in imel je pozornost, vse stvari, ki bi jih moral izkusiti vsak otrok, ko odrašča. Tudi življenje Isusa ni bilo vedno tako. 10 let je bil omejen na majhno posteljo na trpani sobi v tako imenovani instituciji za otroke v Bolgariji. Tam so ga hranili, tam so ga preoblačili. Njegovo celotno življenje je bila njegova postelja in strop nad njo. Ni bilo niti okna, skozi katerega bi lahko gledal. Nikoli ni občutil topline sonca na obrazu, niti vetra v laseh. V Bolgariji so desetletja otroke z ovirami strgali iz njihovih družin in nameščali v prenatrpane ustanove s premajhnim številom zaposlenih. Pomanjkanje pozornosti in sredstvi pripravlja do tega, da so mnogi izmed njih umrli zaradi zanemarjanja. Ko je Isus dobil okužbo, so zdravniki rekli, da so naredili vse, kar so zanj lahko, in da je takoj ustanova čakala, da tudi on umre. Potem pa je njegovo življenje stopil nekdo izjemen. Po 20-letni karieri na področju oglaševanja je Dima pustila službo in se vpisala na tečaj za delo z ogroženimi otroki. Napotena je bila v ustanovo, kjer je spoznala Isusa. Ob njenem prvem obisku je bilo stanje v instituciji zadošljivo. 38 otrok je živelo v 5 majhnih sobah. Smrad v prostorih je bil neznosen. Tudi Isus je takoj pritegnil na pozornost. Njegove velike lepe oči so gorele v nežni duši, povedala Dima. Od tega trenutka sta se njuni življenji spremenili zavedno. Ob podpori Lumusa je Dima še naprej obiskovala Isusa. Z vozičkom ga je vzela ven na igrišče, ki ga je Lumus pomagal zgraditi. Ko je Isus prvič začutil veter na obrazu, se je začel smejati. Dima ga je objela in v njegovih očeh je opazila solzo. Ustanova Krošari, kjer je živel Isus, je bila ena največjih in najbolj razvpitih institucij v Bolgariji. Vlada je Lumus pozvala za pomoč. Lumus je poslal ekipo strokovnjakov za stabilizacijo zdravja otrok in začelo se je delo, da bi jih preselili v alternativno oskrbo. Dima je zdaj že 5 let Isusova rejnica. Njegova zdravnica je presenečena nad velikim izboljšanjem, ki ga je opazila pri njem. On je borec, pravi zdravnica. Verjetno je vedno vedel, da ga nekje čaka mama kot je Dima. Če bi ga le srečala prej, zdravnica ugiba, bi njegov razvoj še bolj napredoval. Zgodba o Isusu in Dimi je ena izmed tistih, ki se trenutno odvija v Bolgariji. Zanj je to sedaj nov začetek. Z Lumusovo podporo Dimina odločitev, da postane rejnica, ni bila praktična ali ekonomska izbira. Bila je izbira med življenjem in smrtjo.
Thank you very much for interpretation, very much appreciated. I think that without the interpreters, which are very often left behind or not thanks to, we wouldn't be able to cooperate in many cases. So I just would like to also stress that what I came across quite often is, okay, so the institutionalization, that's something, you know, which is like, it's not our task. We have our good system, and we don't need any advices from the abroad. I just would like to ensure such resistant people that actually these changes are coming across the whole region of Europe, I would say, or at least the Central and Eastern Europe in last 10 years. And that's from my point of view, this process is unavoidable right now. And I just would like to share with you some examples which actually are quite similar to each other, because in Ukraine and in Moldova, Ukraine is on the start of this process right now, and Moldova is almost at the end of this process. Thanks to the introduction of inclusive education system in mainstream schools, it enabled a huge thousands of children actually with disabilities to return to their families, because the inaccessibility of mainstream schools had been the main and only reason why the children had been put to institutions. And also they are in Ukraine, as I said, they are on the start, but they are also developing foster care for children with disabilities who can't be from or for different reasons to reunited with their biological families. And Bisser already introduced the long-term process which went in Bulgaria, and I would like to stress again that this plan, which you are also Katarina and Andrea mentioning from the morning, this is very important part of the whole process. And in just the example from Czech Republic, there was the big as in other countries, actually, you mentioned, there had been the big European Union project, which led to transformation, not all, but to some of the the most old-fashioned institutions in the country. And right now, and in frame of that, there had been the creation of the small group homes. And also there had been the enrich of recruitment and support for foster carers who care for disabled children. So there are the ways, there are the examples from the same region, from very similar context as Slovenia has and had in the past. So this can be also used for advocacy. And why I'm talking about the advocacy, if I can ask Bisser for next slide. Thank you. My last slide, or my two last slides, this is the one of the last ones. I just would like to very fastly introduce some elements which are crucial for successful process of the institutionalization or transformation of the system. These elements, Lumos has the training which can take 2 to 4 days. So my time is very limited, so I can't go to the details, but I would like to introduce you these elements which you have to consider and plan around, which is the behavior change communication. That's really awareness making targeted towards the public and the experts in the system, why actually change is needed. It's also activity towards the members of parliament or any other stakeholders who can amend the legislation and who can actually approve the strategic plan on the national level. What's also very important then, it's to provide the activities around strategic review, which means the description of the current situation, the description of the starting point, what is existing right now, what are the reasons why the children are there, what kind of services in community does exist already, what needs, and it will give you the picture, what needs to be added to the system and what needs to be rescheduled. And then a very important element is this. Also, the redirecting of resources is very important thing, and Andreja Rafaelič mentioned at the morning that even the Slovenia is quite well off country. Slovenia is not rich enough to have to actually finance 2 parallel systems of care. And I just would like to say that actually none of the countries is rich enough to finance parallel system of care. So also to think about the redirecting, not just the finances already allocated to the system, but also about the people working in the current system and about some special equipments and some material things which are in the system. It all will save you the money for new system. What is a very important element, of course, is the assessment and preparation of children for changes. And there had been several times mentioned that and I think that in George's presentation it was visible that with careful assessment and careful preparation, you may prepare much more better future also for the children who had been heavily institutionalized and which conditions are very severe one. What's sometimes forgotten and not discussed intensively enough is actually the work with the people who are working in the system, with the carers who work with the children and adults with disabilities on the daily basis, because these people need to be supported in the process. They need the additional trainings about new methods and about the changes which are coming to their actually daily life of work. And if you don't support these people well enough, it may cause quite high center of the resistance, because these people are afraid they are going to lose the job. They think that they are criticized for what they did so far, even if they did it in their best meaning. And many of them really like to work with the children, and they really like the children. But the system doesn't allow them to work effectively. So it's crucial also to plan how to work with staff of all the people who are working in the system. It's very important also to think about how the management structure will be set up, and how the logistic, the real implementation of plan will happen. And what's important also is to monitor and evaluate whole the process. What I didn't mention, if I may just dwell for last second on the previous slide, what I didn't mention to all these elements actually is the motive of child participation is coming. So child participation in advocacy is very crucial to let the children with disabilities, their voice to be heard. But also, for example, in assessment and preparation, George mentioned that also there may be some children who never had the opportunity, or adults who never had the opportunity to decide which t-shirt they would like to wear, or which color on the wall they would like to have in their new placement. So these are the small details and big details, but child participation element goes through all these things I mentioned right now. Last slide, Bisser, please. We just discussed with Bisser that we have so limited time that we just will pull up few things we came across in our own countries, but also in some other countries we had opportunity to collaborate in, or to work in, or to talk to colleagues from that countries. So it's very critical really to change the approach towards the persons and children with disabilities from the medical model to social model of care. So it means not to say what actually children can't do, but to see what they can to do, and what society needs to support them in, to be able to include them to the community. What was quite common challenge we came across was that when there had been, where the process of DI started in the reality, and the management of institution or management of region, or whatever it's organized in the Slovenia, for example, the system, when they had been planning the services, we find out that they are planning the services for the children who has just very low or mild level of disability, and are seen so-called able. And the children which needs the biggest support, with the profound level of disabilities, usually in the planning had been left behind. And it can lead to the situation that you will have almost empty big institution, but you still will have 20 or 15 children who need very intensive support, and you will run out of the money, and these children are in a risk to be either stay in the institutional setting, or to be moved to another institution just to economize the whole care or process. So what we would like to recommend is to plan for the children and adults also who needs the highest level of support, to prioritize them in the planning. And the last thing which we also came across in many countries, especially in my country, for example, that sometimes the different departments doesn't talk to each other. What I mean by that, the children with disabilities are in my country in social services, so they belong under the Department of Social Services. But from my point of view, they are also children in risk, so they should be under the Child Protection Department. But in past, these two departments didn't communicate well enough in setting the proper ways of the services. So it needs to involve all the relevant professions to one table, including, for example, teachers and including some other experts. It's up to how your system is organized and how much fragmented it is. So I would like to wish you good luck. We, as George proposed, Lumos also would like to propose further assistance with your activities, and we are very happy with Bisser to share our experience later on or again.
Thank you very much, Petra, for this very informative but also practical and useful presentation. And I really liked also that you showed this short film, because it brings the reality of what we are talking about today closer to us. So thank you very much again.